What if every single morning your feet are trying to warn you about something serious happening deep inside your body, and you've been ignoring it for years? Not because you didn't care, but because nobody told you what those changes actually mean. A puffy foot, a numb toe, skin that looks different than it used to. These are not signs of aging. These are your body's emergency signals, and the organs sending them may already be in serious trouble. Today I'm going to show you 9 warning signs your feet display every morning and what each one is actually telling you about your heart, your kidneys, and your blood sugar. Stay with me until sign number 5, because that one surprises almost every patient I've ever shown it to, and it may be the most important one of all. Every week, patients walk into my office with foot symptoms they've had for months, sometimes years, that nobody connected to anything serious. That changes today. My mission is not just to treat disease. It's to give you the knowledge to catch what's coming before it catches you off guard. Let me tell you about Margaret. She was 67 years old, retired school teacher, walked 2 miles every morning, ate well, and thought she was in good health. She came to see me because her feet looked a little puffy when she woke up. Nothing dramatic, just something she noticed and couldn't explain. What we found during her workup stopped both of us cold. Margaret had early-stage heart failure and elevated creatinine, suggesting serious kidney stress. On top of that, her blood sugar numbers put her squarely in prediabetes territory. 3 major systems DAV already affected all at once. She had 4 of the 9 signs I'm about to show you. She just didn't know what she was looking at. Now you will. According to the Centers for Disease Control and Prevention, over 37 million Americans have diabetes right now. And roughly 1 in 5 of them don't know it yet. They have no diagnosis, no treatment, and no warning. The American Heart Association reports that nearly half of American adults live with some form of cardiovascular disease. Here's the good news. These signs are visible, they're free to check, and catching them early gives you real options. So let's start with sign number 1. Sign number 1, tide, morning swelling that goes down by afternoon. Most people assume this is just fluid from sleeping. You were lying flat all night. What's actually happening is your heart may not be pumping efficiently enough to move fluid out of your lower extremities. Think of it like a drain that's slightly clogged. Water backs up slowly and quietly. You don't notice anything is wrong until the sink is already full. A study published in the Journal of the American Geriatric Society found that persistent lower limb edema in adults over 60. In other words, swollen feet in the morning are not always harmless. Sometimes they are the earliest signal that your heart is struggling to keep up. My daily recommendation? Press your thumb firmly into the top of your foot for 5 seconds. If the indentation stays visible, that's sign number 2, cow, a burning or tingling sensation in your toes when you first wake up. Most people assume they slept in a bad position. This process begins years before a diabetes diagnosis ever appears on a lab report. By the time it's confirmed, the nerve damage is already well underway. What's actually happening is that persistently elevated blood sugar damages the small nerve fibers in your feet first, a condition called peripheral neuropathy. Think of your nerves like electrical wiring inside a wall. High glucose slowly corrodes. The American Diabetes Association states that diabetic peripheral neuropathy affects up to 50% of people with diabetes. And in many cases, tingling in the feet is the very first symptom a patient ever notices, years before a formal diagnosis is made. Sign number 3, skin on your feet that looks unusually shiny or stretched. Most people assume dry skin or just the way aging skin looks. What's actually happening is fluid accumulating under the skin due to poor circulation or kidney dysfunction stretches the outer layer from within. The skin isn't dry at all, it's under internal pressure, and that tight, glossy appearance is the surface showing you something is wrong underneath. Think of it like a water balloon that's been slowly overfilled. The surface becomes taut and shiny, not because it's healthy, but because My daily recommendation: in natural morning light, look at both feet side by side. If one or both look unusually smooth and stretched, sign number 4, toenails that are thickening, yellowing, or growing more slowly than they used to. Most people assume this is just a fungal infection. Research published in the National Kidney Foundation's clinical guidelines identifies skin tightness and abnormal sheen on the lower extremities. What's actually happening is that poor circulation reduces the nutrients and oxygen reaching the nail bed tab, and slow growing. This is sometimes due to peripheral arterial disease, a condition that quietly narrows the arteries supplying your legs and feet long before any pain or cramping begins. According to the American Heart Association, Peripheral arterial disease affects over 8 million Americans. Think of your toenails like plants at the end of a long garden hose.
Right.
When water pressure drops, the plants furthest from the source suffer first. Changes in nail appearance and growth rate are among the early signs and they often go unrecognized for years because nobody connects them to circulation. My daily recommendation: once a week, check your toenails in good lighting. Note color, texture, and growth. If 3 or more nails are showing. Sign number 5. One foot that consistently feels colder than the other every single morning. What's actually happening is that asymmetric coldness between feet is a classic clinical sign of unilateral arterial blockage. Think of it like 2 radiators connected to the same boiler, but one pipe has a partial blockage. One room stays warm, the other never, and that foot is literally receiving less warmth because less blood is arriving. The difference isn't in your blanket, it's in your arteries. A study published in JAMA Internal Medicine identified asymmetric lower limb temperature as a significant. What makes this sign especially dangerous is that it often precedes pain or cramping by many months, meaning the blockage is progressing silently the entire time. My daily recommendation: every morning, place one hand on each foot simultaneously and compare. Sign number 6. Small red or purple spots under the skin of your feet. Most people assume a minor bruise. They disappear eventually, so no concern. What's actually happening is these spots, called petechiae, indicate that small blood vessels are leaking beneath the surface. This can be connected to blood pressure instability, platelet irregularities, or early signs of vasculitis or clotting disorders. Think of your smallest blood vessels like tiny glass capillaries. When internal pressure spikes or vessel walls weaken, the National Institutes of Health notes that petechiae on the lower extremities that do not blanch when pressed are considered a clinical warning sign requiring prompt medical evaluation. I want to stop here for just a moment and ask you something directly. How many of these signs have you noticed PAV or dismissed PAV in the past few months? My daily recommendation: if you notice new pinpoint red or purple spots on your feet, press on them with your fingertip. If any of this is sounding familiar, type the number in the comments right now. Type 1, 2, 3, however many signs you've recognized in your own feet. And if this information feels like something a friend or family member needs to hear, please hit the like button right now. Every like helps this video reach more people. Sign number 7. Dry, cracked heels that don't respond to moisturizer. Most people assume this is a hydration issue, or what's actually happening is that thyroid dysfunction, particularly hypothyroidism, dramatically reduces the skin's ability to retain moisture and regenerate properly. Chronically cracked heels that resist treatment are one of the most overlooked thyroid symptoms in adults over 60. The problem isn't on the surface, it's hormonal. Research from Harvard T.H. Chan School of Public Health links untreated hypothyroidism in older adults to skin. My daily recommendation: if your heels have been cracked for more than 4 to 6 weeks, ask your doctor for a TSH blood test. It's simple, Sign number 8. A feeling of heaviness or fatigue in your feet and legs, specifically in the morning, before you've done anything physical. What's actually happening is morning lower limb heaviness before any exertion is a recognized early sign of venous insufficiency. Think of the veins in your legs like a series of one-way doors pushing blood back up toward your heart. When those doors fail, when those valves don't close properly, blood flows backward between beats and collects at the bottom half, making your legs feel heavy and fatigued before the day even starts. The American College of Phlebology estimates that chronic venous insufficiency affects up to 40% of adults, with symptoms. My daily recommendation: before getting out of bed, elevate your legs against the wall for 2 to 3 minutes. Sign number 9. Loss of fine sensation on the bottom of your feet. You step on something small and don't feel it. The floor feels slightly different than it used to. What's actually happening is that loss of protective sensation on the plantar surface is one of the most clinically significant signs of advanced peripheral neuropathy. A landmark study published in Diabetes Care found that loss of protective sensation in the feet is present in up to 60% of patients. The same study found that early detection through simple sensory testing can reduce amputation risk by more than 50%. My daily recommendation: once a week, use a thin object like the cap of a pen to lightly touch different areas on the body. Let's bring everything together, because you now have information that most people never receive until something serious has already happened.